of you might be thinking about expressing. And when people think about expressing, they think about using a pump. But actually in the early days, that's really not the best thing to be doing. With colostrum being thick and sticky and gloopy, it's much better to do hand expressing, as shown in a previous video. When the milk starts to change, somewhere between days 3 and 5, you'll start seeing it become runnier, lighter in colour, and just much more of it. And that's the time to think about maybe moving on to a pump. The reasons that you might be thinking about pumping are to increase your milk supply if you're struggling. We mentioned earlier about the 4 reliable signs, and if your baby needs a bit more milk, then expressing is the way to go and to get more milk into your baby and push your supply. Your baby might be struggling to attach to the breast, and in maintaining your supply then is really important, because we only have a 2-week window to really maximise your supply. So getting the milk out of the breast and getting it into your baby does 2 wonderful things. It pushes your milk supply and it feeds your baby. You may be separated from your baby, which is another really big reason for people to express. They may be on the special care baby unit. And the other reason is that some people would like their partners to be able to give a bottle. So thinking about pumps, there are all sorts of pumps at all sorts of budgets. But the key to it really is ensuring that the pump works for you. It's how you use the pump is really important, much more than what you've paid for it. So we're going to show you in a moment how to use a pump. So let's talk about pumping. So before we actually think about putting a pump kit on, we actually need to try and get oxytocin flowing. We've talked about oxytocin quite a few times on these videos. Oxytocin is the hormone that releases the milk into the breast. So things that can help with releasing oxytocin are a bit of breast massage, and I've got Naomi, my colleague here, who's going to show you. So you can try a bit of breast massage. So something that's nice, something that you like. It shouldn't be anything you don't like. Might think about being in a nice quiet room, no interruptions, being warm enough, not needing to go to the bathroom, having a drink to your side, all really helps with oxytocin. So massage helps. Maybe having the baby nearby helps too. Sniffing a baby's head is fabulous for getting oxytocin flowing. So these are all the things you want to start with before you ever think about putting a pump kit on, because a pump kit is a piece of plastic and that oxytocin doesn't flow for plastic. So having done all of that, you're trying to get that oxytocin flowing. If you're separated from your baby, a picture of your baby is a really good thing to have nearby, and in these days a little video would be even better. So thinking about the pump, so we have here a hospital grade pump, but as I said before, there are lots of pumps on the market, and a hospital grade pump is just one of them. It's how you use it's most important. We need a pump that fits you. So these pumps come with internal flanges to make them slightly smaller, and what we want is for them to fit. We don't want it to be too small. What we don't want is the areola and the nipple to be rubbing on the inside. We want the nipple to have free movement to go in and out of the flange. So it would be a case of trying for you the right one for you. So once you've made sure that the flange is going to be okay for you, we often talk about double pumping because that gets the best hormonal response. So Naomi's going to show how we hold the pump kits on the breast. So we'd normally hold them between the fingers and put the nipple central. Almost do the pump a bit closer to you, Naomi, couldn't we? Okay, and that one. And if you were feeling inventive, you could try a piece of tubey grip to put the pump kits through around the top, or a cut-up crop top or an old bra. Really good way of holding the pump kits on. And then with these pumps, if you have the choice, you have cycles and vacuum. So what we do is we always mimic a baby, and we start with fast cycles, because when a baby goes on, they go chomp, 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 chomp to get the let down, and medium vacuum, not too much. And when the milk starts to come into the flanges, you can start seeing it dripping. You slow it right down to slow cycles, and up the vacuum to wherever is comfortable. And you carry on while the milk's coming, and we never put a time on it. We say watch the flow and not the clock. So we're looking at what's happening, the milk is flowing, and while the milk is flowing, we keep going. And when it starts to slow or stop, we have a little break. We turn it off, And Naomi gets her opportunity to stretch her arms and have a drink and then start again. And this is because what babies do is pause when they're feeding. And we've covered this in other videos, that your baby will feed and pause and feed and pause. And what we're doing is we're mimicking that. So each time that you turn the pump kit on, you're telling the body, I want a bit more milk. And that's how we push our supply. So you can do this a number of times. We'd say have a couple of breaks so that maybe you're expressing the breasts 3 times. What you can also be doing, if you're feeling really dexterous, is a bit of compressions. Can you show us the compressions, Naomi? So that's in and hold and release. And in and hold. And if you're having to increase the amount of milk you're giving your baby, if you find the right place on your breast to do compressions, you can do the same when you're breastfeeding, and that delivers that little bit more milk into the baby. Brilliant. Once you've done as much as you can, and you're not getting any more, we would then suggest you try a bit of hand expressing. Shall I relieve you of one? You can tip the flange over and you can express into it. And we may not get very much at this point in time, but what you are getting is really high fat, really rich droplets of your milk. Fantastic. That's that pump session over. And we would be looking to be doing expressing a minimum of 8 times in 24 hours if you're trying to boost your supply. If you're doing it for the occasional feed, because your partner would like to have a feed or you need a little bit of time off, then that would be probably just after the first feed in the morning, when most women have more milk than they need. But if you think about if you're trying to boost your supply, then it would be after every feed, or a minimum of 8 times in 24 hours. And bearing in mind that feeds are irregular, most babies do not feed to a pattern. They'll have 8 to 13 feeds in a 24-hour period, frequent but not regular.